Hello, and welcome to the Drug Discovery module. This module will provide you with an overview of the steps involved in finding a new compound for use in a therapeutic product or a diagnostic product. First, I'd like to clarify what I mean when I refer to a compound. A compound can be made using chemistry or biology, and when given to a patient, can treat or eliminate a disease. As you might imagine, these compounds are not easy to find, and in fact, are becoming harder and harder for scientists to discover. In the last century, we effectively discovered most compounds occurring in nature and synthesized all small and easily synthesized chemicals. In this module, I'll explain to you how today's drug researchers go about discovering new drugs and why it's not quite as easy as it used to be. In the early days of drug discovery, we didn't know where to look. Many known drugs were simply home remedies passed down from earlier generations, and nearly all of them were initially discovered by accident. One of the most influential drugs ever discovered was actually discovered by accident. One day in 1928, a scientist named Alexander Fleming was observing the bacteria he was growing in a petri dish in his lab. He came across one dish that appeared to be contaminated with some sort of fungus. Before discarding the ruined sample, he noticed something strange. The area around the fungus growth was completely void of the Staphylococcus bacteria he was growing. Not realizing the full potential of his discovery, he isolated this mold juice and planned to use it to prevent certain types of bacteria from growing in other experiments. It wasn't until Howard Florey, another scientist at Oxford, began researching the use of this mold juice to treat wounded soldiers in World War II that the full potential of penicillin was realized. Recognizing the drug's life-saving potential, Florey traveled to the United States to enlist the help of the U.S. Department of Agriculture and pharmaceutical companies. With their help, improved methods for synthesis and purification of penicillin were developed, and the age of antibiotics had begun. While much less common today, these discoveries by serendipity still occur. However, it's unlikely that any will have the same global impact as penicillin. For drug discovery today, a more methodical approach involving university researchers, government agencies, industry, and philanthropic organizations is necessary. Today, the discovery stage initiates the drug development process. In order to get a single drug all the way through development and to the patients that need it, drug developers start with approximately 10,000 potential drug candidates. The development process is important because it systematically filters out all other 9,999 of these potential compounds and selects the very best new drug. Of course, these numbers aren't exact, but you can begin to get an idea of the process of narrowing down the best candidate. The drug chosen at the conclusion of this process will have the best balance of effectiveness and safety and should be the best candidate from all the 10,000 compounds that were considered at the beginning of the discovery stage. Over the next few minutes, we'll discuss the stages of drug discovery and provide examples that will hopefully illustrate how those stages can result in an approved drug. The drug discovery process can easily be broken down into 3 stages. 1. Identify a drug target. 2. Screen for compounds that bind to that drug target. And 3. Optimize these compounds to produce a lead candidate. These steps describe the most commonly accepted approach to drug discovery, although there are methods that differ slightly from this standard approach. These alternate methods will be mentioned, but our primary focus will be on target identification, compound screening, and lead optimization.